Anemia is a condition characterized by a deficiency in the number or quality of red blood cells or a lack of hemoglobin, the protein within red blood cells that carries oxygen. This results in a reduced ability of the blood to carry oxygen to the body's tissues, leading to various symptoms. Anemia can range from mild to severe and can be temporary or chronic. The symptoms of anemia vary depending on its severity, cause, and the individual, but often include fatigue and weakness, shortness of breath, dizziness or lightheadedness, pale or yellowish skin, cold hands and feet, rapid or irregular heartbeat, headaches, and chest pain in severe cases. There are many causes, which can be grouped into three main categories. Blood loss can occur from heavy menstrual periods, gastrointestinal bleeding, trauma, or surgery. Reduced production of red blood cells can be due to iron deficiency anemia, which is the most common type, often caused by a lack of iron in the diet or poor absorption, vitamin deficiency anemia caused by a lack of folate or vitamin B12, chronic diseases like kidney disease, cancer, and rheumatoid arthritis, and bone marrow disorders such as leukemia or aplastic anemia. Increased destruction of red blood cells can occur in hemolytic anemia, caused by conditions that destroy red blood cells faster than they can be produced, and sickle cell anemia, a genetic disorder where red blood cells are shaped abnormally and break down prematurely. Diagnosis typically includes medical history and physical exam to assess symptoms and risk factors, a complete blood count to measure hemoglobin levels, red blood cell count, hematocrit, and other indices, a peripheral blood smear to examine the shape and size of red blood cells, iron studies to measure serum iron, ferritin, and transferrin levels for iron deficiency anemia, vitamin B12 and folate levels to diagnose vitamin deficiency anemia, and sometimes a bone marrow biopsy if the cause of anemia is not clear. Treatment depends on the underlying cause. Iron deficiency anemia is treated with iron supplements and dietary changes to increase iron intake. Vitamin deficiency anemia is treated with supplements and dietary modifications. Anemia from chronic diseases requires management of the underlying disease, and in some cases, medications to stimulate red blood cell production may be used. Hemolytic anemia is treated with medications to suppress the immune system, or in severe cases, blood transfusions. Sickle cell anemia may require pain management, blood transfusions, or medications that help prevent complications. In severe cases, blood transfusions or bone marrow transplants may be necessary. Prevention strategies include eating a balanced diet incorporating iron-rich foods, vitamin B12, and folate, iron supplementation for people at high risk or as recommended by a healthcare provider, managing chronic diseases, and genetic counseling for inherited anemias. Early diagnosis and management are crucial for preventing complications related to anemia. If you experience symptoms of anemia, consult a healthcare provider for proper evaluation and treatment.